Hi everyone, and welcome to this video on periampullary carcinoma. Periampullary carcinoma is a rare type of cancer that arises from the cells of the ampulla of Vater. The ampulla of Vater is a small opening at the end of the common bile duct and the pancreatic duct. These two ducts carry bile and pancreatic juices from the liver and pancreas into the small intestine. The ampulla of Vater is a mound-like opening in the duodenum. The duodenum is a C-shaped loop of bowel at the beginning of the intestine. It is where the bile duct bringing bile from the liver and pancreatic duct, which brings pancreatic juice from pancreas, meets and then opens into the intestine. Periampullary cancer is a term used to refer to cancer that occurs in the vicinity of the ampulla of Vater. This includes cancer affecting the head of the pancreas, distal bile duct, cholangiocarcinoma, duodenum, and ampulla. These cancers are grouped together because they share similar clinical features and treatment options. Although they are all adenocarcinomas, their prognosis varies. Surgical removal of these tumors, if possible, offers the best chances of a cure. Periampullary cancer refers to different types of cancer that occur around the ampulla of Vater. These types of cancer include 1. Pancreatic cancer, a cancer that originates in the pancreas. 2. Distal bile duct cancer, cholangiocarcinoma, a cancer that arises from the lining of the lowermost part of the bile duct, where it passes through the pancreas, joins the pancreatic duct, and ends in the intestine. 3. Duodenal cancer, a cancer that arises from the lining of the duodenal mucosa. The duodenum is the part of the small intestine where food from the stomach mixes with bile and pancreatic juice. Most duodenal cancers originate in the second part of the duodenum, where the ampulla is located. 4. Ampullary cancer, a cancer that arises from the lining of the ampulla of Vater. Old age, smoking, family history, or hereditary conditions. Chronic pancreatitis, obesity, liver flukes, primary sclerosing cholangitis, gallstones, choledochal cysts, familial adenomatous polyposis, FAP, Gardner syndrome. The most common symptoms of periampullary carcinoma are abdominal pain, jaundice, icterus weight loss, change in stool color. Other symptoms may include nausea and vomiting, fatigue, back pain, loss of appetite, dark urine. The following signs may be present on physical examination. Murphy's sign, Courvoisier's sign, a palpable gallbladder in a patient with jaundice. Bloomberg's sign, rebound tenderness in the right upper quadrant of the abdomen. Hepatosplenomegaly, enlargement of the liver and spleen. The following investigations are used to diagnose periampullary carcinoma. Blood tests. Blood tests may be used to assess liver function, pancreatic function, and tumor markers. Imaging tests. Imaging tests such as CT scan, MRI, and EUS can be used to visualize the tumor and its extent. Biopsy. A biopsy is necessary to confirm the diagnosis of periampullary carcinoma. The main treatment for periampullary carcinoma is surgery. The most common surgical procedure is the Whipple procedure, which involves removing the head of the pancreas, the duodenum, the first part of the small intestine, the gallbladder, and a portion of the bile duct. Other treatment options for periampullary carcinoma include chemotherapy and radiation therapy. Chemotherapy is used in metastatic carcinoma. Radiation therapy is used to shrink the tumor.